A warm welcome to your weekly health show, Health and Lifestyle, where we talk all matters health. Today we are coming to you from the Kenya Medical Research Institute KEMRI in Kilifi County, where scientists are conducting a study on neosepsis. Coming up in the program.
So they are highly susceptible. So when they come out, they are prone to a lot of things. And because their hospital stay will be longer, that also predisposes them to infection.
Nurses on the front line, protecting newborns against a deadly infection.
What happens when these bacteria are existing within the environment and they're exposed to things like antibiotics which are meant to kill them? So their genetic material starts evolving to try and evade being killed by the antibiotic.
The researchers racing against time to find new drugs to reduce newborn deaths. And prevention is better than cure. Simple steps parents can take to protect babies and how early action and good hygiene can help stop deadly infections in newborns. All that coming up in the Good Practice segment. And to our first segment. At the front line of treating babies with sepsis are nurses. Floyce Ombeso is a nurse at the Kilifi Level 5 hospital. She explains what it takes to manage babies with sepsis. Every morning, Nurse Floyce Ombeso steps into the newborn unit at Kilifi Referral Hospital to look after a special group of patients. Newborns delivered prematurely.
Because they are not well developed, they've not gotten their maternal protection antibodies that are normally given to the baby from the mother towards the end of the delivery or towards the end of the pregnancy. So they are highly susceptible. So when they come out, they are prone to a lot of things. And because their hospital stay will be longer, that also predisposes them to infection.
Oftentimes, because of their immature development, their immune systems can't handle severe infections such as sepsis. Sepsis is a deadly bacterial infection in the blood that can lead to aggressive inflammation of vital organs in these little ones. Sepsis is often difficult to diagnose. Its symptoms include fever, fast or slow heart rate, reduced sucking or difficulty feeding, and at times jaundice, yellowing of the skin and eyes.
Okay, just as the symptoms, we manage them according to the way they present. So most of the time initially, we normally do the ABC approach when the babies come. As a nurse, you do the ABC, you check the air, how is the airway, how are they breathing, how is the circulation, and what is their capability at that time. So you see the mother, maybe I see the baby is not breastfeeding, so you assess that. And then the temperatures. Temperatures will also pick up immediately. When you say this high temperature, there could be something that is happening.
The biggest challenge in treating sepsis in newborns is antimicrobial resistance, AMR. This is when the bacterial infection no longer responds to commonly used antibiotics.
As a protocol, the way it states, we start with the first line antibiotics. And from there, we could, if maybe after 2 or 3 days, we are seeing the infection is not, or the vitals that we're expecting, especially the temperature, and just generally the way the baby is not doing well, we could now go to the second line antibiotic.
To confront this growing crisis of antimicrobial resistance, AMR, the Kilifi Newborn Unit is now part of an international clinical study spearheaded by the Global Antibiotic Research and Development Partnership, GADP, in collaboration with Kenyan scientists from the Kenya Medical Research Institute KEMRI in Kilifi. The study, dubbed NEOSEP, is crucial, says Professor Samuel Kariuki, Africa Lead for Drugs and Neglected Diseases Initiative, in finding effective antimicrobials for newborns.
Every age group in the life of a human being is a special age group in terms of their physiological ability to either process drugs or medicines, and also the ability to be able to fight antimicrobial resistant pathogens or any pathogens that affect them. And we must treat each age group as very, very unique, because if not, then we'll be using the wrong treatment for certain age groups. So this study here comes to set the proper standards so that as patients are being treated, as neonates are being treated, they're being given the right dosage for the right duration and for the right treatment in terms of affecting the pathogens that are affecting them.
A clinician by profession, Alex Mokazi works for the Kenya Medical Institute KEMRI in Kilifi. He is the study coordinator for the NeoSep clinical trial in Kenya. His work entails protecting the integrity of the study, ensuring every baby meets strict criteria.
We recruit babies who are between the ages of 0 to 28 days and who basically are admitted in hospital with signs of sepsis. And they must have a weight of more than 1 kilo for NeoSep and must fulfill the criteria of having 2 signs of severity or severe signs of infection. And basically we must ensure that these babies do not have any contraindications into either of those drugs that we are going to give them.
The community is equally involved. Here, medical decisions are a family affair.
And we must ensure that we inform the mothers and they understand what the study is all about, and they are given a chance to give an informed consent. And this basically we have to inform the mother of all trial procedures, all benefits and all risks pertaining to the trial, so that they can come up with an informed decision. And one thing we have to remember is that we can always tell the mothers that involvement is voluntary and it can be resigned at any time and without any consequences. And the child will continue with the normal management as any other child in the ward.
Despite challenges, Kilifi enrolled 13 babies in the first phase NeoSep 1 study with only 1 withdrawal, a success he calls significant.
Results showed that basically the dosages that we were giving are sufficient to treat these children with sepsis. That's where we are now in part 2, because we had confirmed the doses. Now for part 2, basically we are trying to see whether different combinations of antibiotics, to begin with fosfomycin combined with amikacin, or flumoxef combined with amikacin, or flumoxef combined with fosfomycin can improve survival.
GADP has now rolled out the second phase of the study with 600 babies across Kenya enrolled.
So for Kilifi, we are enrolling 200 babies between the ages of 0 to 28 days with severe signs of sepsis. And across Mbagathi and Coast General, we are going to recruit a similar number of babies with them being randomized either to receive one of the 8 combinations of antibiotics that has been pre-selected for each site.
What has been happening previously sometimes is a trial and error, and you don't want to do that. Sometimes what certain physicians may do is to try to compare maybe older age groups and then de-escalate to the lower age group. But then you see that is a variable from one physician to another. But here we want to try, through this study, standardize the treatments that will be very specific to this age group and for severe infections, including sepsis. So this is one of the main reasons why this study is important. Yeah.
With very few antibiotic trials happening for newborns, GADP's research fills a major global gap to find guidelines to treat the most vulnerable of children around the world.
When you work so hard and at the end of the day you lose the baby, it really breaks our heart. Being a parent myself, a mother, I feel that it's traumatic more when you go home, you've already done shopping for this baby, you're anticipating to have the baby. Maybe the family members, even the siblings, are waiting for a baby who is coming, and then they are told the baby is not okay. So if we incorporate these medications that have already been researched on, but you just want to see how they work in units, maybe the time of being in hospital will be reduced, and we can reunite the families back home earlier than before.
And on that note, we take a short break, but I'll be back with much more, including the lead investigator in the Kenya NeoSep study, Dr. Christina Obiero. Stay tuned. Welcome to the program. Now, the Kenya NeoSep study is being done in 3 sites here in Kenya. That is the Mbagathi Hospital, the Coast General Hospital, and right here where we are, which is the Kilifi Level 5 Hospital, led by scientists from the Kenya Medical Research Institute. And to speak to us more about the Kenya NeoSep study is none other than the lead investigator, Dr. Christina Obiero.
So sepsis in neonates or newborns is serious infection which can be life-threatening, and it occurs in newborn babies during the first 20 days of life. And sepsis results from exposure to germs that cause infection, such as bacteria. And when babies are exposed to these germs, this leads to bloodstream infection, so it's infection in the bloodstream. And this can become complicated with organ dysfunction if it's not treated early with appropriate antimicrobials or antibiotics in this case. So babies who have sepsis present with non-specific signs and symptoms, and this include temperature abnormalities and difficulty in breathing, or they could present with inability to breastfeed. And because the signs and symptoms they come with are also found in other babies who do not have sepsis or infection, then it becomes very challenging for a clinician to distinguish those babies who have true sepsis from those who do not have sepsis. So sepsis is an important condition for us to pay attention to, because its burden in newborn babies is quite high. It's among the leading causes of hospitalization and death during early life, and particularly in low and middle income countries where the burden is high, as I've mentioned. And in addition to that, these countries in such settings such as ours do not have adequate capacity to detect sepsis in a timely manner.
So, just like you've already explained what sepsis is, and I know the multiple, can I say, response that the body can give, and you'll be able to detect as a medical, practitioner that this is more than just any bacterial infection. But how do babies get it? Because you're talking about babies between 0 to about 28 days, and how their survival is impacted by sepsis. But we would want to just understand, how do babies get this kind of infections?
Sepsis could be acquired from the mother, and mostly now this would be early onset. So babies could be born with infection, which presents very early in life, and this would be infection that they acquire from the mother while they are in utero, so before the time of birth, or around the time of labor and around the time of delivery, or soon after. When it comes to managing babies who have sepsis, we do follow the guidelines that we have, and we have the Kenya National Pediatric Guidelines, and these have been adapted from the WHO guidelines. And the guidelines recommend starting babies who present with signs and symptoms that are suggestive of sepsis with antibiotics, and they do specify which antibiotics that the babies should receive. So these are ideally penicillin combined with another antibiotic called gentamicin. And penicillin can be substituted with ampicillin. They work in a similar manner as they are in a related class of antibiotics. So we have that recommendation from the guidelines that babies presenting with signs and symptoms of sepsis need to be started on antibiotics, and these are the antibiotics they should be started on. However, we find that babies present in very non-specific non-specific ways. So we start all babies on antibiotics, but at the same time, some of the babies who are initiated on antibiotics, we are not sure whether they actually have sepsis. And this is because our setting has limited capacity to diagnose sepsis. The gold standard test for diagnosing sepsis is a blood culture. So a blood culture is essential in diagnosis sepsis in newborn babies. However, most government health facilities do not have a well-equipped microbiology laboratory. In addition to that, there's lack of adequate qualified and trained staff on performing microbiological diagnostic tests. And so for the purposes of diagnosing sepsis, what we usually do is we need to take a sample for blood culture, and that's taken to the lab for further analysis. And usually, if the culture becomes positive, then that result will inform the clinician on whether they need to change antibiotics or not, based on the antibiotic susceptibility test that is done. So the lab would test that bacteria against different antibiotics to see which one it responds to, and then that information would be the clinician would use that information to make decisions on whether they need to change antibiotics or continue with the ones that the patient is on, including, and the decision also is impacted by the clinical progression of the patient. How is the patient doing well on treatment?
So let's talk about this study now, the Neonates 1 study that is currently being conducted at KEMRI, Kilifi. So what is it all about? First of all, just letting us know what the study is aiming at.
So the study is called NeoSep1. It's a short name of the trial, and it's funded by GADP. In long, GADP stands for Global Antibiotic Research and Development Partnership. And GADP is working with other stakeholders to accelerate the process of defining or developing antibiotic combinations that can be used for treating babies who have sepsis, given the challenges we currently face when it comes to treatment of these babies. And this include lack of effective antibiotics in the pipeline. So the process of developing new antibiotics, it's very costly and it takes a long time. And the other thing also to note is we don't have many options in the pipeline now. So the antibiotics we're using, there's resistance already. What are the alternatives that we can use instead of the ones that we currently have, right? And the other thing I also wanted to point out is related to when you look at, we've talked about sepsis being a huge problem among babies. At the same time, also resistance is a huge problem. When you look at how babies are affected versus older children and adults, they are disproportionately affected because they have an immature immune system, so they are not able to fight infections as well as older children can, and also as well as adults. So what key stakeholders such as the WHO, GADP are doing is they are looking at which other antibiotics do we have which have not been used as much as what you're currently using for babies with sepsis. Therefore, we expect they do not have high rates of resistance in our setting, and can these antibiotics be used for other purposes? So what you call repurposing antibiotics. And some of these antibiotics they're looking at are older antibiotics such as fosfomycin and flumoxef. Fosfomycin and flumoxef are antibiotics which were developed many years ago, discovered many years ago in the 70s.
So part of the study, which is in collaboration with GADP, is also trying to find, the combination of antibiotics that can be used in this very vulnerable, if I may call them, part of the population who are the babies or the neonates for that matter. So what exactly is this study trying to look at in terms of the existing antibiotics?
This trial, the NeoSep1 trial, is investigating new antibiotic combinations. So the new combinations are flumoxef, and fosfomycin when they're given together or in combination with amikacin. So investigating the new combinations and also comparing them to the currently used combinations for treating babies who have sepsis. And the first part was a confirmatory pharmacokinetic phase. So by kinetics, what I mean is we were investigating the characteristics of antibiotics when they're given to a patient to try and see what concentrations are available in the blood at certain time points, and which concentrations are available and effective in treating a baby who has sepsis, and which doses are the appropriate one for this particular baby. So the first part was done in Kilifi and 2 sites in South Africa. So that's Tegaberg Hospital and Baragwanath Hospital. We are hoping to start the second part of the trial in the coming few days. And this is a larger part of the trial which will be conducted in several sites in Sub-Saharan Africa and Asia. And in Kenya, we have 3 sites. So in total, approximately 3,000 newborns will be enrolled in the trial. But for the Kenya sites, the 3 sites, we aim to enroll approximately 600 newborn babies. And that's at Kilifi County Hospital in Kilifi, at Coast General Teaching and Referral Hospital in Mombasa, and then at Mbagathi Hospital in Nairobi.
Yeah. Is the study also hoping that it can also inform some guidelines or policies for WHO, because even as the treatment is going on right now in terms of just generally how to treat bacterial infections, has to be in line with WHO guidelines. Is this study also hoping to do that, to give some, inform how the WHO can actually give new guidelines on how these babies can be treated?
Yes. Yeah. That is the aim of the trial, essentially to generate data on which antibiotic combinations are the best for treating babies, given how they present with sepsis. Because when you look at the design of the trial, it's taken into account that babies do have different profiles as much as they may be labeled as sepsis. Some of the babies are admitted at term, others that come to us when they're preterm. The other thing also to note is that some present with sepsis early in life, early onset sepsis versus late onset sepsis. So some of those factors have been taken into account when designing the trial, so that at the end of the day we can be able to make recommendations on which antibiotics are the best for babies based on their patient profile or other local factors such as the epidemiology of sepsis locally with regards to what's causing sepsis, and also what are the antibiotic resistance rates and so on.
Sepsis in newborns is a serious condition, and parents play a key role in prevention. By recognizing early signs and practicing good hygiene, families can protect their babies and ensure they get timely medical care. Number 1, practice good hygiene. Wash hands before touching the baby. Ask visitors to do the same, and use hand sanitizer when needed. Limit exposure to illness. Keep newborns away from sick people and avoid crowded places in the early weeks. Watch for signs of infection. Seek urgent care if you notice fever or low temperature, poor feeding or vomiting, unusual sleepiness or irritability, breathing problems, worsening jaundice, that is yellowing of the eyes and skin, pale or bluish skin, low urine output, seizures or strange movements. Keep the umbilical cord clean. Keep it dry and clean. Look for redness, swelling, bad smell or discharge. Support maternal health. Attend prenatal appointments. Get screened and treated for urinary tract infections and sexually transmitted infections. Report fever or infection during labor. Maintain a clean environment by cleaning bottles, pacifiers, and feeding equipment. Wash baby's clothes and linens regularly. Breastfeed if possible. Breast milk provides protective antibodies. Avoid excessive pet contact. Keep pets away from the baby's face and hands. Wash hands after handling animals. Last but not least, seek medical care early. If something seems wrong, don't wait. Early treatment is critical. We've come to the end of the program. Thank you so much as always for your time and your company. And by now you've learned what neosepsis is all about and how it is life-threatening. My name is Marie Yambo, and on behalf of everyone who made this program possible, including the scientists from the Kenya Medical Research Institute in Kilifi County, we say thank you and we hope to see you again next time.